Thanks everybody for joining us. It's really exciting to see so many people on in a remote conference. I know for me, I miss all of us being together. It was one of my favorite events. It is one of my favorite events every year, is participating in the Service Coordinator PA conference. And so while we are together remotely, definitely I look forward to being together in person again, hopefully in the not too distant future. So thank you for joining us. And thank you for the land acknowledgement, Melissa. And we will move forward with our general presentation. And the goal here is really just to talk through our service system, things that I think we might have new people who have joined us over the course of the last couple of years. And so this hopefully is good information. And if you've been with us for a while as a service coordinator or PA or in a role similar, this is kind of a refresher. We'll talk through COVID-19, have a little bit of discussion around ideas from you all in terms of what you'd like to see from us in terms of response in the future. And then I'll share what's happening with the budget and our legislative bills. And then at the end, we'll go through some awards for service coordinators and case management entities. So, and then I think then hopefully we'll have time for questions. For those who have been in person, I think you all know I open it up to just broad, any kind of question you can think of. And you guys are good at coming up with lots of different types of questions. So we want to do that at the end of this as well. Thank you. And Caitlin is running the slides while I'm talking. So I'm going to do that thing where I say next slide. So thank you, Caitlin.
I told you you could wiggle your ear for me, but
you
can
say
say next
yeah,
slide.
I can't do that without using my hand, which is pretty awkward. There we go. Oregon's Developmental Disability Service System is built on the idea that we support people with intellectual and developmental disabilities across the lifespan. I would say that makes us unique in terms of other ODHS programs, just because when somebody comes into our system, usually as a child, they continue in our system and stay all the way through the rest of their life or until they leave Oregon. And so we really have to focus in our work, both on kids, transition age, employment, adulthood, and then ultimately even end of life area. So I think that's an important part of what we do, is just understanding our work is across the lifespan. And while we as workers in this field may come in and out at different times, the people who are supported in it and the families are in it for the long haul. They remember what happened in the past. They know they're looking forward to the future. They experience the system every day of their lives. So another critical part of our system is that it's built on partnerships. We don't have, as everybody knows, we don't have a bunch of state offices scattered around the state with state employees. We work through and with you, our partners at the state government, local governments, nonprofits, provider agencies. We work with self-advocates, obviously, and families, as you all do in your day-to-day work as well. For those that don't know this, the Office of Developmental Disabilities itself in ODHS, we oversee the system. We do operate the 24-hour stabilization and crisis unit with state staff. And then we have state staff that provide case management for children with significant needs who live either in in-home settings or in residential settings. This is part of the presentation. We've modified it a bit for you all, but this is part of a presentation I gave to legislators during session. And so I think it's easier for this group to understand why our work matters as opposed to explaining it to a legislator. But I'll go through this as well, just, so everybody understands why we're here and why we do what we do. We believe that all individuals, regardless of their abilities, deserve to live healthy, safe lives that are free from abuse and allow them to achieve their highest potential. We want children with intellectual and developmental disabilities in Oregon to grow up with the same expectation as any other child. We want them to recognize that they will become and can become contributing, valuable members of their communities. And of course, our focus on integrated community employment, community integrated employment continues across the board for everyone. These are our vision statement and mission statement that we developed several years ago now with a group of stakeholders. People and families access quality supports that are simple to use and responsive to their strengths, needs, and choices while they live and thrive as valued members of their community. And our mission statement is really to work with stakeholders and the DD community to come together to provide services, supports, and advocacy to empower Oregonians with intellectual and developmental disabilities to live full lives in their community. At this point, each of you represents a different case management entity that serves a different number of people depending on where you're at and how big your organization is. Across the system, we serve about 10,000 children now and 21,700 adults. I'll get my numbers right. We do that through 31 community developmental disability programs and 14 brokerages statewide that serve adults in in-home settings. So I wanted to put these numbers in here, the number of CDDPs and brokerages, to kind of give you an idea of scope. Each of you work in a specific organization, have a specific organizational structure, whether it be county government or a brokerage, nonprofit brokerage, or CDDP, but ultimately each of you represents a part of a bigger system that ultimately we need to work together to operate as a state system. And so that presents opportunities, and ultimately I would say that presents challenges, as you all probably experience when you're working across programs or across systems. One of the things I will note that I see as an opportunity that I'm very excited about and thankful for is that earlier this year, just a couple months ago, we received notice from Mentor Oregon that they were going to leave services in Oregon. They were not going to provide any more service in Oregon and we're going to leave the state. We ultimately, as a result of that, we're thinking about what we would do, not only for the people who receive their residential services or employment services, but for the 1,200 to 1,300 individuals that were served by their two brokerages. And through the strength, I would say, and the commitment of our DD service system, we had other brokerages step up and agree to expand and create new brokerages to support the people who are who were being supported through mentor brokerages. And I think as of the state might still be, but we'll be transitioning soon to either SDRI, RCO, or the UCP brokerage. So we are grateful for our partners and how they step up. We've had other situations where we've had CDDPs return their contracts, say we don't want to be a CDDP anymore. And then we've had other CDDPs step up and say, we'll take that work. And so while managing a statewide system with lots of partners is not easy and creates challenges, it also creates lots of opportunity for collaboration and for strengthening our system and for working together to step up when we have people who need us to do that. So my thanks specifically to everybody involved in that process, the mentor employees who are hanging in there, the new brokerages that are taking those individuals, and I appreciate that the process thus far has gone smoothly, and we'll continue to work with you all to make that happen. Next slide. COVID-19 has been the big focus for all of us for the last, I think the calendar on my refrigerator now says 18 months. So 2 years in, 18 months. We all know and learned early on that people with IDD are at higher risk of adverse outcomes if they can track COVID-19. So we had to work quickly to put a lot of rules, policies, procedures, emergency processes in place to protect the people we support. With our case management entities, ODDS, we quickly issued new policies and guidance, created animated videos explaining COVID. I think this is a snapshot of one of those videos that we produced around making a decision about whether or not to return to work. Case management entities offered remote case management and remote monitoring. We created staffing support resources that are still needed today, probably needed now more than even at the beginning of the pandemic, frankly. And we came up with creative ways to help support people. So again, nobody could have imagined, I don't think, what we've gone into over the past couple of years. But what it did demonstrate is that when we work together, we can be, even though we're big bureaucracies, we can be agile, we can be responsive, and we can do what we need to do to take care of people. These are some examples of more examples of what we did around vaccines for the IDD population. The first part was an internal bureaucratic process where I participated in discussions in a work group that identified the different phases that people would be eligible for the vaccine. This was back when vaccines were not as widely available as they are today. We made sure that the IDD population was in that first phase 1A. We had the federal and state pharmacy partnership that also worked to get vaccines out to people in residential settings. We connected CMEs through local public health authorities and their clinics. We continue to encourage coordination between CMEs and public health authorities and coordinated care organizations to help people get vaccinated. Our last data point as of July 2021 is about 74% of individuals with IDD across all settings are vaccinated, which is a good percentage. It's not where we want to be ultimately by the time we're through this, but it is a high percentage. And overall, I think we've been tracking a little bit higher than the overall population percentage for the state of Oregon. Then we also created a number of toolkits that people with disabilities and their families can use to access information about vaccines. We also have learned very quickly that emergency response is a part of our day-to-day work. I recall earlier in my career that, we talked about emergency preparedness and emergency response, but it was always with that idea that it probably wouldn't happen. That in Oregon specifically, I think in the Pacific Northwest, but definitely in Oregon, that is no longer the case. Emergency response, emergency preparedness has become a part of our daily work, whether it be wildfires, ice storms, extreme heat, smoke, whatever the situation may be. We work with case management entities to develop emergency plans and protocols for individuals. We push again coordination at the local level between the case management entity and their local emergency operating centers is usually, they have some title along those lines. For the wildfires last year, we had about 400 individuals receiving services that were evacuated from their homes for at least a day. We implemented funding for people to be able to stay in hotels. We also funded air purification systems. We've now expanded that rather than just waiting for the need for an air purification system. We recognize that people might need, you need to have that ready when there's smoke in the air and you need to use it. And we worked to ensure that people had safety checks and we were checking in with everybody. The ice storms again, I was going to say last year, but actually I think those were just earlier this year. The ice storms, again, we worked with CMEs to coordinate local emergency response when people lost power for a long period of time and were not able to leave their homes. We've also been heavily engaged at the state and at local levels in moving forward racial justice and service equity in our system and across all systems. Equity is a cornerstone of our strategic plan for ODDS, and we are committed to that work and the hard work of systems change. I think one of the things that I've really come to recognize in the context of these discussions and how this discussion has moved forward and how this work moves forward is that as people who work in a disability service system, we are engaged in equity work on a day-to-day basis, whether it's around people with intellectual and developmental disabilities, or it's around people who have intersectionality of issues like race, color, diversity, and disability. And so our work, I haven't thought of it as equity work until recently, but definitely our work is equity work. We want people to be included in their communities. We want to ensure people are treated like fairly and appropriately. And so while we definitely have a lot of work to do in terms of that for the people we support from different communities of color, we also understand how to do this work because we do it a lot on a day-to-day basis, and we need to do more of it. The next bullet point just talks to the fact that the disability rights movements are built upon the foundation of civil rights movements. We're all better when we elevate and support those who are most marginalized. I hope all of you have had a chance to watch Crip Camp. It is an amazing story of kind of the roots of the disability rights movement and how you can see through that movie how it intersected with other rights movements, LGBTQA movement, the civil rights movement at the time. It's exciting to watch that history and kind of get a better understanding of the overall disability rights movements. Case managements are stepping up and advocating to improve equitable service delivery. We have a work group of service coordinators and PAs that are really helping all of us move forward. That group brainstorms and we works to provide technical assistance. And we have service equity sessions scheduled for this summer learning session. I encourage those of you, even if you're just curious, even if you haven't engaged in this before, in this work before specifically, I would encourage you to participate and just go listen with an open mind and learn. And thank you for people answering questions in the chat. I'm seeing them pop up, but I'm just going to keep talking. So COVID-19 collaborations, moving back to COVID-19 collaboration, we kind of went through the story of what happened, what worked. We went to remote services. We created coordination between CMEs and public health. We initiated weekly check-in meetings with case management leadership. We started those really more than anything, not to push information out, but to also gather information about what's happening on the ground, because I know that we at the state have to work hard to hear what's happening on the ground level. And this was one way that we did that throughout this process. We implemented the staffing support resources that we continue to have available to us and are trying to expand. We changed some rules and regulations with CMS emergency approval to make things easier. So I think overall, these are just some examples of the things that we implemented fairly quickly with CMEs that from our perspective made a difference and helped people during COVID. Some of the things that could have worked better, I don't know. Did you put that line on the presentation just now?
I didn't. Somehow it just appeared. I saw like a name and then a line floated. I don't know. Cool new feature of Zoom that we're all learning about now together.
Everybody can write on the presentation. Go for it. Things that could have worked better. I mean, there's not much we can do about this, but the federal pharmacy partnership was a bit of a mess. It did help get vaccines out to some settings, but it didn't live up to the expectation that I think we all had. And for reasons we don't know, we had submitted all of the names of our residential settings, for example, to be a part of it. And at the CDC federal level, they dropped most of them off. So we didn't know about that until much later in the process. So there was lots of confusion there, not much we could do about how that operated at the federal level, but just acknowledging that was a challenge. I would say our continuing ongoing struggle without a case management system. A lot of what we shared back and forth was in, emails, spreadsheets, et cetera, the way we do things. We had a challenge getting consistent, broad messaging out because of our inability to kind of really have all the information on how to contact people at the state level. And then again, one of the first things, if you recall, we asked CMEs to do was to go identify the people in your respective agencies who were the high-risk individuals and help share that information with us, because we didn't have that handy for ourselves at the state. We've got a time here to discuss for a few minutes. People can feel free to raise hands and talk or type into the chat. Just asking you all, as we think about what the next emergency might be, and I hate even saying that, but we know it's going to happen. What are some ideas from your perspective that would be helpful for us at ODDS to know in terms of how to improve coordination between the state and what's happening at the local level? And I'm going to watch the clock as we do this so we don't go over.
We're doing okay on time.
Okay, thank you. Everybody's very quiet. Oh, yes. And I'm sorry if I say your name and say it incorrectly, I apologize, but I think this is from Devin. I have an exciting announcement at the end of this presentation about a centralized case management system that goes across CDDPs and brokerages. So stay tuned. Linda, yes, that's a yes. And Barb, I don't know if it's going to be, we've talked about it being zombies or Sharknado or many other things. I hate even putting that out in the universe because it could happen.
We have a comment from Angela Stevenson. They say, having the information ODDS will need when we initially reach out to individuals and families to gather information. So maybe, do you want to elaborate on that, Angela?
Just with the different things that came up this year, sometimes we had already reached out to individuals and gathered information, and then we found out that we needed different information and had to try to contact them again. So just maybe already having the questions that might come up in emergencies. So when we reach out, we can just touch base with them one time and get all the information.
Thank you.
And there's a comment from Heather that says, modify the policies and rules to be in response to any emergency, not just COVID. So the idea may be around an emergency rule that applies across different types of the Sharknado, from Sharknado to ice storms.
Good thought. All right.
I don't see hands up. We can sit in awkward silence for another 30 seconds or so in case people are still thinking things through. Okay.
All right. It also gave me a chance to close my curtains because I was getting blinded. Okay, we're getting some good stuff in here now. We'll capture these. Incentivizing case management to encourage less turnover. Start the emergency with a guide. Okay, versus transmittals. Good thoughts here. Thank you. All right. Now I'm gonna shift gears a little bit and talk about what happened this session in the legislature and with our budget. So we went into session expecting that, honestly, because of COVID, that there were going to need to be reductions, cuts. And I think we stayed in that mode of thinking, you know, right up until the last month or so, when it became evident that there was going to be a lot of federal funding made available. And so we went from being asked to come up with suggestions on reductions to how, to quickly, here's all this money, let's look at, what you've asked to be funded and what we can do with it. So I would say probably from my perspective, this is probably the most money I've ever seen come into a DD service system. And I hate to think that it'll be the last time this happens. I'd like to think it'll continue in the future, but this session just proved to be very unique. And we have exciting opportunities with this funding that I'll talk about through these slides. So just to start with, we have 1.24 billion general fund to ODDS. General fund is important because that's only about a third of the total fund. Our total fund is over 3 million now when you bring in the Medicaid match to that 1.24 billion. Billion, yes. This allocation is about 20% above the 1921 legislatively approved budget and more than a 10% increase over our current service level funding. That's just the funding that we say we need just to keep things going as they are. So about 10% over just things being as they are. Things that we got funding directly for, there was a request through CDDPs that came up as a bill, is to do a study of CDDP funding. The bill was specific to CDDP funding, but I agreed in the process that we would also bring brokerages into the discussion, look at different ways for us to fund case management so that we can, I would describe it as be more flexible, agile, and ultimately do a better job of meeting Medicaid expectations, because the way we currently fund case management entities creates challenges when the caseload projections are off. It also, I would say, doesn't completely comply with Medicaid requirements. And so that's something that we definitely need to look at. We got funding to fully fund our new rate models for services. This is adult group home, all of the various services to move into the new rate models that we've developed over a number of years, working with providers and with a contractor. We're going to implement those on July 1st of 2022. We recently pushed out information both in Express primarily, but then also transmittals for providers to go in and see what service group a person is in based on the Oregon Needs Assessment, so they can adjust and calculate and understand what their funding might look like going into that July 1st, 2022 change. And we were able to do that because the legislature gave us enough funding to fund our full rates as of July 1st of next year. The legislature approved our 10% enhanced federal funding requests. That's the American Rescue Plan Act funding. State systems that provide home and community-based services were given 10% additional FMAP funding as part of ARPA. And the good news, usually when we've got an enhanced match, there's no directive from the federal government that the money has to stay in the service system. So inevitably what has happened in the past, like with the 6% increase and other things that came through in earlier COVID relief bills, is the legislature shifted that money to other places. And so while we didn't get a cut, and that was fine, we also didn't benefit widely from the increased match. With this federal bill, it specifically said the money has to stay in the service system. It has to be used to enhance and expand home and community-based services. And so we put together a plan, a spending plan, gathering input from case management entities and other stakeholders. It's online, you can look at it. I'll talk a little bit more about it later, and I'll go into more detail. We have, we got funding to reduce or eliminate, really look at our translation and interpretation services so we can better communicate, work more closely through CDDPs and brokerages with individuals and families for whom English may not be their primary language. And so we're excited to get that funding to really handle a challenge that I know we've all tried to work through and address the best we can in each of our respective areas. We got funding for 19 new positions in our licensing and quality improvement unit. So we've been falling behind. The growth in licensed settings has increased, while our ability to staff to get out and do the licensing appropriately has declined. So we were fortunate to get those positions in place and funded through the legislature. And then finally, the legislature provided $1.4 million to restore family network funding that had been cut earlier in the biennium. These are the bills. There are lots of bills. Oh, are we? There are lots of bills, thank you, that passed that impact the DD system. This is really limited to the bills we as ODDS introduced to the governor's office that did pass. The first one was about supported decision-making. We went into session with a bigger goal on supported decision-making, hoping to get it really codified in statute, and through, again, a series of negotiations, when it became clear there was not complete stakeholder support for this, not in the DD system, we were all good. But when we expanded and brought in other systems to the discussion, we still weren't 100% lined up. So we really moved the bill to focus on the transition age youth and making sure that information on supported decision-making is available as part of the IEP process. Senate Bill 86 cleans up some licensing language between adult foster homes and group homes, and requires disclosure of ownership of entities. Anyone who owns 5% or more needs to tell us who they are now. And then more importantly as well, or as importantly, I guess I'd say, it gives us the ability to look at a provider performance in other states. We've had situations where a provider in another state real close has had challenges, and we tried to really use that as a basis for looking at their performance in Oregon, and we're not able to do it because we had nothing in statute saying we would. Now we have something in statute, so that's important for us. Senate Bill 88 and 89 are really just cleanup bills, correcting references to CDDP functions, and then clarifying that developmental disability residential facilities refer to children who are 17 years of age or under, not 18. That created some confusion with who was responsible for abuse reporting. And then Senate Bill 90, we got through after a lot of negotiation. Oddly enough, as part of our legislative process, I usually don't end up with discussion with lobbyists for the media, but I did in this case. And so we were able to work this through. Essentially, we now have a legislation that protects disclosure of the addresses of group homes and adult foster homes, but also puts in place a way test that our public records unit and DOJ can decide if the request is in the public interest, then the addresses can be disclosed. But if somebody contacts us, like has happened, and just wants to sell something to everybody in a group home, we're no longer just sending out addresses of group homes in residential settings when anyone asks. So that was an important change to the law. Now I'll get back to ARPA, the American Rescue Plan Act. This just gives the history that I think I gave I talked through on the other slide. So this bill really encourages states to improve their home and community-based service settings. For Oregon, because for our DD system, all of our services are defined as home and community-based and follow those regulations. We estimate the 10% bringing in over the course of the year that's coming in, bringing in about $165 million, which is a huge amount of money to bring into a system, but then also to manage and push out appropriately. Our spending plan, we're going back and forth answering CMS questions right now. I think overall we're going to be good. They also have had questions for APD and the behavioral health system. So we need to coordinate with them on getting all the responses back to CMS and getting CMS's okay on the plan. We can also in the future modify the plan, which is what we're going to need to do. We already know because, for example, we had put the funding for the 19 licensed positions in the spending plan. We got that in the regular budget. That's funding we don't need to use for this. And a couple other examples like family networks and other things that I think, you know, as time goes on, we're going to see maybe we didn't need as much or we need more for different things on the list, and we'll be able to adjust that as we go forward in our reporting to CMS. We also included in that limited duration, short-term positions that we're going to be hiring because this is really going to test our ability to stand up a program really quickly and get it moving quickly. We're excited at the opportunity. As you can imagine, though, when a lot of federal funding goes out the door, it gets looked at and scrutinized quite a bit in the not too distant future. So we're looking at bringing in some staffing positions to help us manage grants and other programs that we're plan to use this funding for. Some of the opportunities that I would encourage you to think about, we do have restoration grants planned for the services that were hardest hit by COVID-19 programs, trying to get them back up to full capacity with staffing and other things. We want to build capacity for culturally relevant providers. This is an area we know we need a focus on, and so we're hoping that by offering grants and funding, we'll be able to work with local community organizations and expand access to culturally relevant services for people with intellectual disabilities and their family. Equity grants to encourage local entities like case management entities to engage with tribes, communities of color, and the LGBTQA+ organizations in their local area. It's a lot of your entities, a lot of you are doing this already. Our intent with this funding is to give some incentive to keep doing it, maybe expand ideas that you already have by backing it with a little bit of funding from the state. Obviously, there's a lot in this that would fund increases for the IDD direct care workforce. There's money in it and the governor's budget for home care workers, PSWs, and adult foster home providers that are represented by SEIU. There's also funding in the regular budget and in this ARPA list for provider agencies to help enhance and incentivize working in DD's system. And then the last bullet is there's also grant opportunities for infrastructure. We have homes out there that we know, group homes, foster homes, there are settings where they haven't been able to invest money in infrastructure improvements, and so we're focused on that being a part of this as well. So those are just a few ideas. I'm sure maybe Angela or Caitlin can drop in the chat the link to the full list of opportunities that's online. Our goal is to get some staff in place and to push some of this funding out as quickly as we can, knowing that, you know, we're going to need to set up grant processes and other things that we usually don't have the opportunity to do. So it's exciting for us because usually our funding is so closely tied to Medicaid and Medicaid billing and Medicaid requirements. While we are reinvesting a lot of this money into those types of services, there's also opportunities here for grants that we generally don't have wide opportunity to provide. Thank you, Angela. There is the link to the list, the full list if you're interested. And as I said, that list will be modified as we go forward, but that list demonstrates what we're thinking right now. The future of services. This is something that, you know, we think about on an ongoing, regular, all the time basis. Service equity is really a focus of our work across the board. We are focused on community engagement. I've talked to a couple of partner agencies, CGDPs and brokerages about how we can do a better job or how we can partner together to get the perspective that you hear from communities of color, different communities in your areas up to ODDS. We aren't directly connected with individuals and families on the ground most times. And so we need to work with you to make that happen. And so I think that's a big focus right now for us, is how we do better with that. How do we get those voices and experiences engaged in our overall process for gathering input. And so hopefully you'll hear more about that as we go forward. We're looking at data collection, how data can inform decisions related to equity, policy making, budget decisions, et cetera, et cetera. So this is a focus, and we are working not only internally in ODDS, but also with case management entities and others on how we move this forward as a system. Rate models, as I mentioned earlier, full funding for that using the ONA-based service groups will start on July 1st, 2022. In-home hours are going to be a later discussion, which seems crazy for those of you that have been involved from the beginning. We really started this work tied to in-home hours, but then it got switched to focus on rates. And so now we need to move the rates out, and then we'll handle the in-home hour adjustments out based on service groups after that. So all the information that's come out that we've pushed out recently that's available now is really focused on the rate discussion. The in-home hour discussion will come later. Blueprint project, again, for those of you that have been around and involved for a while, you heard about the Blueprint project. We put out those recommendations a couple of different times now to get feedback. We're also now engaging with families and family groups directly to get their feedback on the recommendations, just to make sure we have a wide ability to gather input from community groups, communities of color, you know, that may not have otherwise had the opportunity to be directly engaged in the process. So that is something that's moving forward. I think if it didn't go out in the last day or two, it'll go out soon. A notice about grant opportunities for community groups or family groups that may be interested in facilitating some of the focus groups around the Blueprint project. And we encourage folks to look at that and share that with anybody in your local community that you think might be interested. ISP redesign process and project is still there. Again, you know, I look at all these things and know we've been working on them for quite some time. I think we'd be in a different place had we not had a pandemic. But the good news is we know that these are things we still need to do, and they're things that hopefully, as our pandemic focus maybe slows, although maybe not, we'll be able to move these projects forward again, including this effort around ISP and the ISP redesign process and embedding outcome measures in the ISP. So that'll be out, that's expected out a little ways, but it is definitely, I wanted to share it here so you know it did not drop, it did not die. We are working on it. We're just going through other things, and then we'll be picking this up in a big way. Family networks, for those who are interested, as I mentioned earlier, the funding was restored. We're going to be issuing an RFP again for family networks. We're at a point in the contracting process where we have to do an RFP for these entities. And so that's something we're working on right now with the DD Council. Now for the big exciting news that somebody asked about early on. We submitted to CMS a request to get a really high level of federal match, 90 cents federal, 10 cents state, which is available through CMS to work on IT projects. We submitted that earlier this year and did get approval on it. What is exciting about that is with that approval, we were going to figure out how to fund it, you know, with only 10 cents of every dollar needing to come from our budget. We were going to make it happen. We were going to figure out how to do it. Then we got the ARPA opportunities. So we definitely have the funding to move this forward now, no question. We are recruiting a project director and project staff. Once they're on board, we're going to host a kickoff meeting. We're going to use this to gather input from case management entities and from stakeholders. We've got active, yes, woo-hoo is right. Thank you. We have stakeholders have been very active in advocating for this, even though they're not directly tied to like a CDDP or brokerage or even a provider agency. So we're going to be working with them to kind of get ideas, self-advocates and families on what they would like to see, you know, what information would they like to be able to have access to potentially through a system, and try to put something together that really meets the needs of the system across the board, and gives us the ability to know more about the people we're supporting at the state level. Also, though, allows for easier transition of people potentially from one case management entity to another, from one provider to another, all the things that, you know, we have steps and processes in place now, but they're pretty cumbersome. Looking for something to make that whole thing easier. And of course, looking at something that gives us the ability to, you know, my dream someday is to pull information, data that says, you know, these are people's ISP goals at a high level. How are they making progress on their ISP goals? What does that look like? Rather than having to read through thousands of PDFs of ISPs, really having it embedded in a system that we can track in real time. Obviously, it would include progress notes and other things. Rather than us sending back spreadsheets and emails, it could be embedded in a case management system. So I'm very excited about that. I know the project is going to take time, but just the fact that we finally got the okay and have identified the funding for it is a big win. This project was pushed off for many years because of the one system. And so I think we're at a point though now where this becomes our highest IT priority, and the way we've kind of laid it out, you know, we're going to work with OIS, which is our Office of Information Services, not the Organ Intervention System. It's our internal OIS. We're going to work with them, but we're going to be, you know, driving the process primarily. So and those of you that advocated for that with the legislature this last session, thank you very much. We are very grateful for that. All right. Do we want to do, Caitlin, did we remove questions here? Okay, just want to make sure I'm following the slides correctly. Thank you. So at this point, I'm glad to open it up again before we shift gears. All questions, whether they have to do with what I've shared or not. We do have some, I'll be real quick on this and then we can switch to questions. We put this presentation together, a few even wrapped it up earlier this week. Things have happened since then that I do want to make sure folks are aware of. A transmittal got posted yesterday, and we're going to be sending out a director's message today or tomorrow. We, unfortunately, due to the spike that we are definitely seeing in COVID cases, especially among DSPs, frankly, but also amongst people with intellectual and developmental disabilities, we are re-implementing mask requirements, for putting back the requirements we had in place that we'd let go of for group homes and adult foster home settings.
And supported living.
And supported living, thank you. And the group and day requirements continue as they are, but that just came out yesterday and a message will go out today. We're asking for implementation by the end of this week, just on masking again in these smaller residential settings. The other thing, I'm sure everybody saw the governor's announcement about directing OHA to put a rule in place that allows or requires, it's not allow, requires healthcare entities or health settings to either test their employees weekly for COVID or allow the employee not to have to test if they verify that they've been vaccinated. We are working right now very closely and quickly with OHA and the COVID response and recovery unit or crew to sort out, to find out. This is a situation where we're going to find out what DD settings are included in that rule. We expect the rule to come out today or tomorrow, and at that point, we'll know for sure what settings are included. We've already been contacted, of course, by providers who are, some of whom love this and are grateful and have wanted to implement these mandates, but held off because
Is Lilia frozen for anyone else?
they're afraid that staff who don't want to be vaccinated are going to leave. So we are going to be balancing a lot of difficult challenges with this. And as we get more clarity and information on what it's going to mean for the DD system, we'll be sharing that out.
A question from Devin. Do you see that in the chat, Lilia?
I do, thank you. Actually, yes, this is something for people who may not see the chat. He's being asked about embedding the ability to do electronic signature in the case management system. That is something we're working on right now. Absolutely, yes, I think is the answer to that. I'm reading quick. I just saw a question. When will the ONA replace the CNA for families new to services? Unfortunately, that is going to be a little ways off. We're doing rates July 1st of next year. The in-home hour pieces will be coming after that. And we're going to need to engage with CMS in discussions around moving into that before we spend all of our ARPA money, because there's a maintenance of effort requirement. We think we can demonstrate that this doesn't violate that, but that's going to require discussion with CMS. So we're unfortunately a ways away from the in-home hour piece being driven by the ONA or the ONA. Thank you for asking. Good question.
I don't see any hands up, but feel free to raise your hand, and that's another way we can call on you to unmute and ask questions. We have a question that just came to me, but I'll say it out loud for everyone else. It says, any updates on Kids Res and either new or repurposed funding? And then what is the holdup with in-home rates, since this was the driver of the lawsuit?
Okay.
So 2 questions.
Kids Res, I'm not sure I'm understanding the holdup there. We've fully funded those rates. Kids residential rates are fully funded. The only change, and not only are they fully funded, they're also using the ONA service groups. So that money that happened as of September, I think, if I recall correctly. I can't remember the exact timing that we went into the service groups for them. Or January this year, I think, early this year. I'm lost my calendar, mental calendar. They also, Kids residential rates also got the it turned out to be about 8.2% rate increase that everybody, even current rates, got as of July 1st of this year, all those rates. So I need more information on that question because I'm not sure what it's about. The holdup. It is in-home hour was the driver of the lawsuit that's now been stayed for more years than I can count, 5 or 6 years. We're still working with DRO on rule language. I think we're, nearing the end on that. I think we've met, come to agreement on most of those items. The holdup really is the fact that we've got this money now for rates, and so we need to get that. Our number one objective this biennia is getting that rate money out the door. That we have to do that by July 1st of next year. And then the other piece of it now for in-home hours, we were planning to go into in-home hours around the same time. The other piece with in-home hours, I'll give more details than I just did, is that now with the ARPA funding, there's a Yes, some people go down, but some people will also go up, and it's a big systems change. It's not a cut to individual specific people, reduction for individuals. So the holdup is all of the work on the rates, getting that nailed down, getting that done, and then going through discussion and question CMS on the impact of the ARPA legislation.
Okay. I'm not seeing other questions. We can give it a few seconds to see if anyone raises their hand or types something else. Thank you so much, Lilia, for giving us your time today.
All right, thank you, Caitlin.
Question on capacity for stabilization and crisis unit homes.
Not at this point. SACU is experiencing the same really challenging staffing issues as everyone else. They are not immune from that. We are having trouble getting staff into SACU, and we did not request any funding for increasing capacity at SACU. Okay, I'm going to keep going on these questions, Caitlin. Is that okay?
Yeah,
do I
let's
need
go
to
till
stop?
11:15 and then we'll move into the celebrations.
Okay, I'll try to talk real fast
Okay.
on these questions. One of the things, you're right, good call. This is a presentation to CMEs. One of the things we didn't mention in our budget slide is the fact that the workload models for case management entities were fully funded. So part of the funding that we got went to restore reductions that have been made in the workload in the case workload models for CMEs last biennium. So that absolutely did happen. And the workload models are fully funded for case management entities. I know that doesn't mean that there's enough money for CMEs to do everything they want to do. That's part 2 of why we want to have that study giving us recommendations on different, maybe better ways to fund CDPs and brokerages in the future. Rolling back up real quick. So I think that answered that one. Okay, I'm getting, thank you for the comments on mask mandates until the pandemic is over. Is there any changes in return of ODDS staff to offices? That actually, I can tell you, we've asked about that internally in our state system, and we have no direction different than what we've been given up until. So I think the goal is still September. For those that are returning to an office, if you're a state employee, maybe you are, Angela. If you were going to work remote, there's a whole process to go through with your supervisor as well. So, we don't have a timeline for implementation of the case management. I'd like to say tomorrow, but we don't have an actual legitimate timeline yet. All right.
Okay. Thank you.
Thank you.
So we're going to move into celebrating our workforce. And I just wanted to kind of give some background on how we got here. The planning committee that typically coordinates the service coordinator and personal agent conference every year was sort of told at short notice last year that the conference was canceled. And then they were able to reconvene this year to plan something different, which is how we got to today's session and all the sessions that are coming up for the months of August and September. While coming together and talking about how to pull off something different that's still safe while we're still experiencing the impacts of COVID-19. The planning committee really wanted to offer something special, recognizing the outstanding work of everyone in this field. You all have stepped up again and again and again, and it has been extremely difficult and often thankless work that you have done, and we recognize that. through a peer nominating process and with review and support from our planning committee. We have a bunch of folks named in here that we want to just share with you a little bit about what they have done, being recognized for a variety of accomplishments these past 18 months or so. I think, Lilia, is that how long it's been, you said, according to your fridge?
Yes, according to my refrigerator calendar.
Yeah. So first, I just wanted to highlight some teams that were recognized for their outstanding work. First of all, Connections Case Management in Coos, Curry, Douglas, and Klamath counties. They're being recognized for really just outstanding creativity, teamwork, and customer service during multiple overlapping emergencies that we've all endured this past 18 months. We have some lovely pictures of all of their faces on the screen for you, and a quote that was submitted with their nomination. And then the Children's Intensive in-Home Services team. So this team was recognized really for centering the voices of people who are most impacted by systemic inequities, the combination of racism and ableism, and consistently advocating for children and families who have the most intense support needs. And then finally, Union County CDDP, we wanted to recognize them for their enduring the hardest year for everyone this past 18 months with all of those emergencies, plus additional hard stuff like their building remodel, their leadership changes, and more, and doing that all with grace, creativity, and dedication to the folks that they serve out in Union County. So thank you to Connections Case Management, CIIS, and Union County CDDP. Some leaders that we wanted to recognize. These are just folks that have gone above and beyond for the people they supervise and the people and families that their CME serves. And these were groups that were, or folks that were nominated by either their peers, their employees, or community partners. So congratulations, Laura, Robin, Barbara, Rachel, and Stacy. These folks, Brooke, Karen, and Jacqueline, are recognized for being bridge builders and service equity. They were nominated for a combination of things, including being champions for change for people experiencing marginalization, including individuals and families they serve, providers they work with, and their colleagues who experience intersectional identities, and for working with people with the highest support needs and always centering their needs and honoring their dignity and treating people with respect. These were all folks that were nominated by peers and partners. Congratulations, Brooke, Karen, Jacqueline. And we wanted to feature Roberta Garcia from Washington County CDDP. Her peers just really wanted to highlight her exceptional support to the Spanish-speaking community over this past 18 months and then long before that, and families of children with high medical needs. So congratulations, Roberta. We're so grateful for you. And another lovely picture. Amazing advocates within our system. These are folks that are recognized for championing high expectations and full lives, the rights of people who are incarcerated, unhoused, navigating mental health needs, or facing other compounding systemic barriers. Carly, Cecilia, Michelle, Mendy, and Katina were all nominated by peers and providers. Congratulations and thank you.
Giving out awards.
Oh, nice.
And please mute if you're not speaking or don't have a question. And we wanted to highlight Pamela's hard work from the time that she was in employment services. We've heard lots of amazing stories about Pamela to her work now at EOSSB. Pamela was nominated by peers and partners for her advocacy and consistent, like above and beyond level of service to the people that their CME supports out in Eastern Oregon. Congratulations, Pamela. And then we have a couple more folks to honor here. We have Gabby, Eileen, Sharon, and Monica, and Autumn for outstanding service in a variety of distinct areas that they were nominated for by their peers. from just the work that they do in customer service and provider enrollment to supporting families during their most challenging moments these past 18 months, the way that they support and step up for their coworkers and colleagues, and how they have amplified the voices of people in all settings and situations to ensure they're heard and recognized as the experts on their own lives. So congratulations to all of you. And I'm moving quickly just to make sure we have time at the end for any final questions. And then finally, we wanted to recognize Sandy Olson from Clackamas County. She was nominated multiple times by managers and peers for all of her outstanding support to people during COVID, during the fires, and all the other personal emergencies that people endured this past 18 months. Meanwhile, helping her colleagues and never missing a beat. So she's recognized for her outstanding work, both visible and behind the scenes. So thank you, Sandy, and congratulations. And thank all of you. I thank all of you, and we all do, for all of the amazing work that has happened over these past 18 months, no matter what you do in the service system. Everyone really deserves an award, but we didn't know how to make that happen. So we're recognizing those that were nominated for some truly outstanding and amazing support above and beyond. Thank you so much. We have a few minutes. I see a whole bunch of comments in the chat, so I'm a little bit afraid to open this up. Okay. Lots of good kudos and congratulations, not a bunch of questions. We do have about 8 more minutes if folks have final thoughts, questions, or comments for Lilia.
Thanks, everybody. Thank you, Caitlin. It would be wrong of me not to leave this without saying thanks to Caitlin.
Thank you. Yay, everyone. Okay. Well, this has been recorded and we will post it somewhere, and someone will inform me how we do that. And we can also get this a PDF of these slides out to all of you. And there's also a short survey that I'll be emailing out to everyone that registered today. So look for that in your email inbox. And hopefully we can see most of you today at 1 o'clock for the session on ancillary services, assistive technology, and assistive devices. Thank you.
Bye-bye. Thank you.
Bye.